everybody. We're going to try and get through this as quickly as possible, but I do plan on this taking a while, so get comfy, get yourself on a good screen with some good audio. All of this is very important. We're going to just jump right into it. Essentially, what's going to happen over the course of this video, I'm going to show you how all of the major players in this little game are connected. I'm going to show you what corporations they're connected through. I'm going to show you the amounts of money that have been invested. I'm going to show you how they are manipulating not only data surrounding COVID-19, but you, the public. And I'm not kidding. I'm going to show you. Okay, this isn't just me saying it. This is a hashtag debunk this Fauci video, which means we're going to show you everything. Okay, stick with us. We've been having problems doing these recordings. We have to do them in one shot, continuous. Don't have money for good software, sorry. So, doing the best we can. I hope you guys can hear me. I've tried to make the words on the screen a little bit bigger. Everybody grab a comfy chair, because here we go. Again, call this a conspiracy theory all you want until the end of the video. You can say it right now, scream it out loud. This is a conspiracy theory. Watch the entire video, and at the end of the video, if you still think it's a conspiracy video, feel free to flame me in the comment section. Just make sure it's done at the end of the video. Thank you. Here we go. The Centers for Disease Control and Prevention Emerging Infectious Diseases Journal, June 2020. It's submitted by Thomas R. Frieden and Christopher T. Lee. Okay, we're going to go all the way down to the bottom to see who these people are. Dr. Frieden is a physician, president and chief executive officer at Resolve to Save Lives, New York, New York, a global initiative and part of the global nonprofit Vital Strategies. He's the former director of the U.S. Centers for Disease Control and Prevention and former commissioner of the New York City Health Department. His research interests include epidemiology, infectious diseases, and public health. Dr. Lee is a medical epidemiologist and senior technical advisor at Resolve to Save Lives. He previously served as medical officer with the Measles Elimination Team, Global Immunization Division, Centers for Disease Control Prevention. You're going to hear that popping up a lot. And importantly, he was an intelligence service officer, an epidemic intelligence service officer assigned to New York City Health Department. Previously worked on migration, health, and disaster response. His research interests include causes and consequences of forced migration, homelessness, and infectious disease epidemiology. So now that we've established who these individuals are and where they are from, Vital Strategies, let's take a look at Vital Strategies. Here they are. Here's the Resolve to Save Lives. Let's look at who funds these people. Dr. Frieden and his experience and vision received truly remarkable funding commitment from 3 of the world's leading philanthropic organizations, Bloomberg, Chan-Zuckerberg, and Bill Melinda Gates. So now that we know who funds Vital Strategies, let's look at who Vital Strategies works closely with: the World Health Organization, Bloomberg School of Public Health, remember that one, at the Johns Hopkins University, CDC Foundation, we've been telling you how they've been manipulating data the whole time, the World Bank, and importantly, the Campaign for Tobacco-Free Kids. This is actually very, 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 very important. Please remember this one. Let's keep rolling. I'm trying to do this quick. So now that we've established that those people from Vital Strategies are trying to supply perspective in this journal, let's look at what this is about real quick. Okay, it's about prevention and mitigation of SSEs. What is an SSE? Oh, I'm sorry, I scrolled the wrong way. Let me get you guys back up here. Superseding events. Okay, the next term you're going to want to know is an NPI. An NPI is a non-pharmaceutical intervention. Okay? Now, down here in the conclusions, they discuss the need for rapidly implementing isolation and response measures. Okay? We're just going to leave it right there. So their whole goal is to use technology, essentially, vital strategies, here they are, resolved to save lives. They want to use technology to trace and track lots and lots of people, similar to what you see happening right here. So here it is. Here's vital strategies, the resolve to save lives. Here's the Johns Hopkins Bloomberg School of Public Health. Here's Bloomberg Philanthropies. And what do these people want to do? They need to put together an army of people to trace each person who tested positive, find out who they contacted, and then isolate those people. Essentially, testing, tracing, and isolating or quarantining aims to contain the virus, to box it in, to give it to no people to spread to surround it by nothing but toilet paper, fluffy pillows, Netflix videos, and whatever else people have in their apartments. These are their words, not mine, folks. Let's keep moving. We're going to do this quick. So now that we've established that the same people trying to offer their perspective to the CDC on how to deal with events like this are from Vital Strategies, and they are funded, at least in part, by Bloomberg, Chan-Zuckerberg Initiative, and Bill Melinda Gates Foundation. Okay, we've just established that. So what you see here is funded by who? It's funded by Bloomberg, Chan-Zuckerberg Initiative, and Bill and Melinda Gates. They are funding this, make no mistake. They are directly involved in this. They have a financial interest in this. Here's the scary part. Do you guys see the video of these two doctors? It was going viral. Good luck finding it now. Here's why.
And of course, that's fair. Decent people have different opinions. We're not entirely certain what the perfect response to this pandemic is. Nobody is certain. There's no objective answer at the moment. At best, we can plod along with open minds and good faith. More informed debate is exactly what we need to make wise decisions going forward. Unfortunately for all of us, informed debate is exactly what the authorities don't want. They want unquestioned obedience, so they're cracking down on free expression. Last night, the doctor's video, the one you just saw, was pulled off of YouTube, the largest video hosting site in the world. It wasn't an accident. YouTube admitted doing it. The company cited a violation of, quote, community guidelines, and they did not apologize. Looking back, when all of this is finally over, and it will be, it's likely we'll see this moment, what YouTube just did, as a turning point in the way we live in this country, a sharp break with 250 years of law and custom. The two doctors' video was produced by a local television channel in California. It was, in effect, a mainstream news story. The video was not pornographic. It didn't violate copyright or incite violence or commit libel. It didn't break any law. The only justification for taking it down was that the two physicians on screen had reached different conclusions from the people currently in charge. It was a form of dissent from orthodoxy. YouTube and its parent company, Google, have now officially banned dissent. The CEO of YouTube admitted that openly.
But then we also talk about removing information that is problematic. You know, of course, anything that is medically unsubstantiated. So people saying like, take vitamin C, take turmeric, like those all will cure you. Those are the examples of things that would be a violation of our policy. Anything that would go against World Health Organization recommendations would be a violation of our policy. And so remove is another really important part of our policy.
So you're not just putting the truth next to the lie. You're taking.
Hi, I'm Rex Moore with the Motley Fool in front of BMW self-driving.
I had a feeling that was going to happen. It's probably going to happen a couple times throughout this video, you guys. I refuse to pay YouTube for their services, so you and I are both going to have to deal with these little pauses.
Pretty aggressive approach.
We're removing, quote, anything that would go against World Health Organization recommendations. It'll now be taken off the internet. Consider that for a minute. As a matter just of science, it's ludicrous. Like everyone else involved in global pandemic policy, the WHO has often been wrong in its recommendations. A lot of people have. In mid-January, WHO told us that coronavirus could not spread from person to person. In March, they told us that face masks didn't work. Those were lies, and they were welcome on Google's platforms. Doctors who are actually treating patients with the virus, meanwhile, have just been banned. So no, this is not about science. Censorship never is about science. It's about power. Big technology companies are using this tragedy to increase their power over the American population. They're working in concert with politicians in order to do it. Just today, Facebook removed an events page for a political protest in Michigan. Governor Gretchen Whitmer, who runs that state, was no doubt pleased to see it. Grossly mismanaging an entire state is a lot easier when citizens are not allowed to complain about it, and now they're not. Last week, Facebook founder Mark Zuckerberg explained that protests like these are no longer protected political speech. They're, quote, misinformation.
How do you deal with the fact that Facebook is now being used to organize a lot of these protests to defy social distancing, defy the social distancing guidelines in states? Is somebody trying to organize something like that, does that qualify as harmful information?
We do classify that as harmful misinformation, and we take that down.
Harmful misinformation. That is a phrase familiar to anyone who has watched totalitarian regimes in any country. It's now how Mark Zuckerberg describes political opinions he doesn't like. Our free press exists to push back against obvious abuses of power like this one. It's the reason we have a First Amendment. It's the only reason we have a First Amendment. But suddenly our media are not concerned about freedom of speech. Reporters applaud our overlords as they punish us for disagreeing. You just saw it in that clip from CNN. That happens every day. Our media are no longer challenging power. They are colluding with power. And that may be why there's been so little critical coverage of the massive expansion of our surveillance state currently in progress. In the name of fighting the coronavirus, tech companies are now following you through your cell phone. They're watching you from above with drones. Those sound like paranoid fantasies. They are not. It's happening as we speak. Needless to say, our politicians approve of this.
How do you feel about the drones?
Look, at this point, we need to save lives, and it's really important that in public spaces, people are abiding by the directives.
Yeah, we've got to do it. So what do we have here? We have big companies partnering with the government to spy on you without your knowledge. Americans locked in their homes, banned from going to church, placated with sedatives like weed and beer. Anyone who speaks up is silenced. Political demonstrations are illegal. Organizers are arrested. Only opinions approved by leaders, many of them unelected, are allowed on information platforms. Does that sound familiar? It sounds a lot like China.
I'm going to stop this right here because it's important, okay? Let's talk about Facebook's manipulation of your data real quick here. I often tell people that Facebook manipulates algorithms and things, and they do. There's no question about it. I'm going to show you. This is exactly what he was just talking about just a second ago. They're directing people to the World Health Organization so they can debunk virus myths and rumors. We knew they liked using that word, so that's why we created hashtag debunk this Fauci. We figured we'd have at least part of their keyword in our keyword, so if they try using it, our stuff's going to pop up. Touché, buddy. Facebook, Google, and Twitter are introducing stricter rules and algorithms and thousands of fact checks to stop the spread of bad information online about the virus. So, here you go. They're up against people's mistrust of authoritative sources for information, such as the World Health Organization. Now, how would they know exactly how to manipulate somebody's Facebook feed, considering if you've clicked on it, reacted to, or commented on posts featuring harmful or false claims about COVID-19? So they're definitely monitoring all your activity, right? Were you aware that back in 2017, 2014, they released a study on the experimental evidence of massive scale emotional contagion through social networks? And that the significance of the study was to show that via a massive number, 689,300 of you to be exact, person experiment on Facebook that emotional states can be transferred to others via emotional contagion, leading people to experience the same emotions without their awareness. Please go through and read this study. We're going to put all the links down in the bottom like we always do. But essentially, I'm going to scroll down here. When positive expressions were reduced, people produced fewer positive posts and more negative posts. When negative expressions were reduced, the opposite pattern occurred. Okay, that's them manipulating your feed. To what extent did they manipulate your news feed? Let me show you. Posts that contain emotional content of relevant emotional valence, each emotional post had between a 10% and 90% chance, based on their user ID, of being omitted from their newsfeed for that specific viewing. It is important to note that this content was always available by viewing a friend's content directly by going to that friend's wall or timeline rather than via the newsfeed, aka shadow banning. Okay, let's move on. Who are they getting help from? If this picture doesn't explain it all, I don't know what does. If these words don't tell you the goal here, I don't know what does. But for argument's sake, let's take a look at it. So they're all about mankind, humankind. I'm sorry, not mankind, humankind. Sorry, ladies. They do things like masking for a friend, a featured campaign. Let's look at who they work with first, though. Bill and Melinda Gates Foundation, the African Union, iHeartMedia, CDC Foundation, Johnson & Johnson, Gordon and Betty Moore Foundation, Schmidt Futures. You're going to see their name pop up a lot. Global Health Strategies, they'll pop up a lot. One, Welcome. These are payment methods if you guys don't know. Okay. Let's take a look at this, though. Let's take a look at masking for a friend. Okay, let's take a look. Click on campaigns. They've got two going right now. Millions and hundreds of millions of dollars. They're rocking two campaigns. Our mission is to promote policies that save the most lives and protect livelihoods, both during this COVID-19 crisis and in future pandemics. Okay. Sounds good so far. Let's see, what do we do here? Campaign engages influencers and celebrities. Oh, okay. Use cloth face coverings in public, protective measures, social distancing, hand washing, contributing to flattening the curve. Okay, so here they tell you that they're using a campaign with influencers and celebrities to try and control your emotions. Again, that's what they're doing here. They've already proved that they can do it. They prove that they can do it without you knowing that they're doing it, more importantly. So let's go back here. For humankind, wash your hands. So they have some nice little media stuff here. Let's click on this and take a look at what we find. Who are you masking for? To protect people around you. We've got the Surgeon General up here. We're going to circle back to this guy in just a second. Now, mind you, it says when you have to go out in public for an essential errand, the CDC recommends that you cover your nose and mouth with a homemade mask. The CDC recommends. Okay, CDC. Not necessarily this guy. This guy's talking about how to make your own. This guy actually had a slightly difference of opinion previously. We're going to circle back to this, though. But anyway, yeah, they're not effective in preventing general public from catching coronavirus. Okay, just that says it all right there. Best way to protect yourselves, everyday preventive action. Staying home, we're going to circle back to that. Soap and water, there you go. That's pretty much it right there. Flu shot, wrong, garbage. If you read, actually this increases your ability to get other coronaviruses, and they don't hide that fact. So, you have masking for a friend. It tells you how to support the campaign. Celebrities from across the world are joining in. They give you a little video. I don't necessarily think that using a Sharpie or something like that to write on your face covering is probably a really good helpful idea. They give you some do's and don'ts. See, like they don't want you capture images or video wearing the mask doing a non-essential task at home or hanging out with friends, as this can send the wrong message. But people are doing that anyway, right? We know that. Don't stand closer to anybody. Don't stand closer to 6 feet. Do not use a medical grade mask. People are still doing it anyway. Okay, so now that we've established that this perspective relies on these people's fundings, it's part of this, we're coming to this right here, that it uses IDSec technology. Okay, I didn't want to skip that in here, but it's actually more important than just this. But this is how they do it. It's IDSec technology. You'll see it right here. Let me grab another just to show you. Here you go. It's in Wired magazine, folks. Back in March 10th, they're talking about it. So let's keep going. We're going to go from masking to a friend. We've now showed you that all of these are connected up to this point. Okay. Now, when it comes to these hoaxes, I want you guys to realize that even if you try sharing legitimate information now, you're going to be branded as a hoax. And I'm going to prove it to you with some information from right here in my own backyard. Okay? This article came out from nationalfile.com. I shared it. It got flagged on social media by a fact-checking site. It says here that our governor sits on the board of a group doing testing, affiliate of prospective coronavirus vaccine maker. Stunning conflict of interest. This might be something people in Arizona want to know about. This guy, on one hand, doesn't get to make legislation mandating testing and vaccines for people, while on the other hand, putting money in his pocket from those mandates. That's illegal. You don't get to do that, buddy. We're all over you. So here's the article. Now, interestingly enough, when I went to the fact checkers, I did a quick search and the media bias fact check site came up. It was the top of the list. So, because I punched in National File fact check. And I came up with this, National File. Has the media source failed to fact check? Let us know here. Convenient. They have the people that released this article listed as a tinfoil hat. Okay, and strong pseudosci level leaning towards quackery. Factual reporting of very low. They're labeled conspiracy pseudoscience. Overall, we rate National File an extreme right tinfoil hat conspiracy website based on the promotion of unproven, debunked claims with a strong pseudoscience purveyor based on using junk science to support the claims. So, the claim is that this guy sits on a board involved in testing in a prospective vaccine maker, and they're claiming it's a conflict of interest. Is that true? This is TGen. Here's the directors, governors. Here's Governor Doug Ducey, governor of Arizona. That's him. That's him. Right there. But yet, this story is a tinfoil hat conspiracy, folks. Let's look at what they're involved in. Okay? Oh, here, we got a pop-up. TGen is proud to support the testing efforts in our state, but we cannot accept samples directly from patients. If you feel required testing, please contact Arizona's COVID-19 hotline. Thank you. Sweet. Thanks about that. I'm glad you guys are concerned working with the state. Never faced a crisis like this before. Really, we face one every year with the influenza epidemic. And these numbers are actually paling in comparison to that so far. And you guys think I'm wrong? Prove me wrong. Don't just say I'm wrong. Prove me wrong. Okay, so at TGen, we are contributing experience and expertise to the effort to fight COVID-19 coronavirus alongside private, state, and federal organizations. Okay, sounds good. They're looking for your financial support so they can scale up testing while contributing to global research and an eventual vaccine for this illness. I think that pretty much says exactly what this says, which would mean that everything this site says is complete trash. This is definitely not a tinfoil hat conspiracy. It's right there in front of your face. Now, let's keep going since we've touched all of the bases so far and connected all of these dots, and we are now at vaccines. Let's just go ahead and jump on the pink elephant in the room.
With Priscilla and with Dr. Don Ganem. Thank you for joining us. Dr. Don Ganem is an expert in infectious disease. Quick background, if you'll allow, is you're a professor at UCSF, the great medical school in the area where Priscilla also went.
Oh, he's so giddy. Look at this guy.
And after that, led the whole infectious disease program at Novartis, developing drugs. And since then,
Big Pharma. If you get bored, Google Novartis lawsuit.
More recently, the way that I've gotten to know you is you've been an advisor to the BioHub that Priscilla and I helped to invest in and helped to spin up. That's a medical research and science research organization based in the Bay Area as a partnership between UCSF, Stanford, and Berkeley. So we're really glad to have you with us today. And we're hoping to talk about a number of topics related specifically around what kinds of medical interventions are going to be possible here to address COVID-19. I figure we'll spend some time talking about testing and what needs to happen there, and medically and scientifically what are the challenges there that need to get addressed. And then I figure we should talk about developing therapeutics. For people who are sick, what are the possible strategies for basically addressing that, minimizing symptoms, making sure it's not fatal, making sure it doesn't have long-term repercussions. And then we should spend some time talking about a vaccine and basically what it's going to take, what the process is going to be, and what goes into building a vaccine that can reach people around the world. So that should take us through, I think, the whole.
Let me just stop there, okay? Vaccine around the world. Let's keep going. Here's another interesting tidbit video you guys might not have seen. It's a Q&A with Mark Zuckerberg and Anthony Fauci, director of NIAID. I already went ahead and gave this one a thumbs down, but let's do it again. Here, let's roll this. Pay attention.
That makes sense. So as part of the public health response, what has been the biggest issue with rolling out testing more broadly, and what are the biggest barriers to expanding testing capacity going forward here?
Well, going forward, it's the good news. What's happening?
Before I let this guy speak, let me just say, we've already pointed out that there's a financial interest spreading from the perspective letter to vital strategies to the Chan-Zuckerberg Initiative to the New York trace testing program going on right now with vital strategies and Bloomberg Philanthropies. Johns Hopkins is in on it. We've already established that this guy and his company, Facebook, are willing to control your emotional states via their platforms. They're willing to manipulate data to control you emotionally. That's been established, okay? So now you have this exact same individual who is censoring information, a classic censor, it's a co-intel right here. Okay, so what you have is they're pushing one agenda while silencing the other. Okay, And they're using the WHO, the CDC, as their main sources of information. If you don't listen to those two groups, they're going to ban your information as misinformation. They've stated it clearly.
What happened is, sobering and unfortunate in that the original system that was put into place for these kinds of responses was not really suited in the best possible way for broad blanket type testing.
And by the way, watch this guy's face. This guy has no poker face. If you played poker with me, Zuckerberg, you would be broke.
Many millions of people would want. It was a test that for certain situations worked well, which depended a lot on the CDC, the public health institutions in the state, and the physicians to ask for a test to go through that process.
Okay, so what you have is now that's the setup part for how the system is broken. Here's how you fix it.
What it didn't do early on is something that, as lessons learned, we clearly will do in the future and are doing now.
Clearly will do in the future and are doing now. New York. Okay, you guys read it. It's happening. It's right there. Let's just move on though. Hold on, let me get back to this guy. What we're clearly doing in the future and what we're doing now
is to involve the private sector.
Is to involve this guy who is censoring information, who is willing to manipulate data to prove that they can control you emotionally. And that becomes a really, really big factor in just a minute, folks.
The heavy-hitting companies who do this for a living, who can give you high throughput testing in the tens of millions, as opposed to something that's a little bit more constrained. So looking forward, we will soon, maybe already, start to see an escalation of the capability of not only getting testers out there, but to be able to implement them. But that's a big lesson learned for next time.
Yeah, so how far off do you think we are from having the testing capacity we need? Is that days, weeks, more?
Yeah,
I mean, I know that our philanthropy at the Chan-Zuckerberg Initiative
Here you go.
Just announced today that we're partnering with Governor Gavin Newsom.
Wow, that's odd, huh? Who's still under lockdown isolation orders? Remember, everywhere that these places are put under lockdown isolations, okay, everybody's told to stay home. Farr's law of epidemics says that if you flatten the curve, you extend the curve. So what is happening is you have a never-ending system. It's a revolving door of data manipulation leading to home isolation policies, which we've already shown you are leading to there we go. Home isolation of persons with suspected COVID-19 might not be a good control strategy because the family members usually don't have personal protective equipment and lack professional training, which easily leads to familiar cluster infections. So home isolation orders is actually leading to an increase of cluster infections. Okay, so when you flatten the curve, you extend the curve. When you increase cluster infections, you mix young people, old people, and what happens is those older people with more comorbidities, what you keep hearing on the news, are the ones that are getting sick and the ones that are dying. These are the same people, I hate to say this, that had a really high chance of getting pneumonia, influenza, or anything else and having the same outcome. So what happens is these comorbidities get changed from U07.2 to U07.1, taking a non-lab confirmed patient, a clinical diagnosis, and making them into a lab confirmed patient so that this guy can go back later on and submit data, manipulated data to follow up their perspective to say, hey, look, we were right. You should listen to us. Let's keep going. I just want to give you the context, the factual background as we keep moving through this to keep it fresh in your memory.
And UCSF here in the Bay Area to increase capacity to more than 1,000 tests per day over the next few days. But nationally, do you think we're at that kind of scale in the next days or weeks, or how far off are we?
I think we're going to be heading towards that scale in the next several days, and certainly in the next couple of weeks. We have been promised by the companies that they'll be able to get the testing out there in a much higher volume than what we have in the past. That's not what I do, Mark, so I can't personally
Now, see, that's contradictory to what he wants to do. So watch Fauci clean it up for him.
guarantee it, but from what I'm hearing and seeing, I think that the right people are in the right place doing that right now.
All right, well, moving on to another thing that may not be what you personally oversee, but you certainly have good visibility into this. A lot of people right now are worried about a spike in the number of patients overwhelming the hospital system and the medical system across the country. So how concerned are you about this and shortage of beds, ICUs, personal protective equipment like masks, ventilators? How are we doing on addressing a potential shortfall, and what more should we be doing there?
Yeah.
Feel free to watch this part for yourself, guys. I'm going to skip forward just a little bit. I'm going to do it so you can catch the closed captions. All right.
Is it a shortfall in all of those resources, beds, ICUs, PPE, ventilators, or are there some things that are more acute than others? Because I've heard discussions around, for example, should hotels be converting into providing extra beds for hospitals? How do you think?
Again, I'm going to skip just a little bit.
About when the right up converting a hotel or something?
Do right now, prepare for it, are not coming right now to delay and cancel elective surgical and medical admissions, because once you let people in who have a procedure that they won't need right now, I mean, that's the way you chew up a lot of resources, beds, masks.
All right, so moving on from what will hopefully be resolved in the next couple of weeks on the spike here, let's talk about some of the longer term strategies for addressing this. You mentioned the vaccine, there are conversations about other therapeutics. Maybe talk for a minute about where are we in the vaccine development? You just announced the first trial for phase 1 to test the safety. What's the time frame for?
Now, please, I hope you guys have been following closely along, and I'm sure that you have. This video is going to be ending in about 10 minutes or so, but this part is extremely important because it gives you insight to the character of this person on the left and the character of this person on the right. This guy has enough money to buy this guy, and it's going to be very clear in just a minute here, okay? But please, focus on him. Focus on Zuckerberg while he's talking. And again, watch the lack of poker face here. Pay attention to his body, his mannerisms, and pay attention to the words that come out of his mouth after this answer from Fauci. He's going to tell you exactly what he feels about vaccines and vaccine research.
Having something like that go through all of the different trials, how could we expedite that? What should people expect on that?
Okay, so if you look, I mean, to give our viewers and listeners a perspective, if this were, 10, 15, 20 years ago, and it was for any vaccine that we wanted to make, you would say a vaccine from the time you start to the time it's approved to be safe and effective is several years, 5, 6, 7 years. That's unacceptable for now. So what happened is that as soon as we got the sequence of the virus from the Chinese, we pulled it out of the public database and stuck the gene into a vaccine platform and worked on it literally within a day of when it came out. 65 days later, namely 2 days ago, we gave the first injection to a normal volunteer for a phase 1 trial to see if it's safe. That's the fastest that's ever been done. That's the good news. The challenging news is that even at that rocket speed, it's going to take a few months to show that the initial safety is okay. Then you go into a phase 2 trial, which instead of involving 45 people, which we have in the phase 1 trial, it involves hundreds, if not thousands of people. That will take another 6 to 8 months to even know if it works. So at the fastest we can go, it's going to take a year to a year and a half to know if we have a vaccine that we can use. So apropos of the question you asked me a moment ago, that if we cycle to another season, that's when a vaccine is going to be very relevant.
Ready?
So one of the questions that I've heard from a number of people is, doing the safety trials obviously is incredibly important because you want to make sure that you're not injecting people with something that could be harmful. But once you have that, why not push harder on rolling it out more aggressively, even if you don't know exactly how effective it is? What's the public health rationale and thinking behind needing to prove that it's extremely effective before rolling out something that you know is safe?
You guys want me to rewind that for you? What is the rationale in proving that something is effective as long as you can prove it's safe?
Okay, that's a good question. The initial
No, it's not. That's a dumb question.
safety study, Mark, is to see if I inject it in the arm, does it have some sort of idiosyncratic or bad reaction? There's another element to safety, and that is if you vaccinate someone and they make an antibody response and then they get exposed and infected, does the response that you induce actually enhance the infection and make it worse? And the only way you'll know that is if you do an extended study, not in a normal volunteer who has no risk of infection, but in people who are out there in a risk situation. This would not be the first time, if it happened, that a vaccine that looked good in initial safety actually made people worse.
Hey, everybody check that out. This would not be the first time. It has happened before. He's going to give you a couple real quick. There's been plenty of incidents if you just Google it. If you choose to find the information instead of choosing to not find it, you will find it, folks. You have the whole world at your fingertips right now. Please stop using it making TikTok videos.
There was the history of the respiratory syncytial virus vaccine in children, which paradoxically made the children worse.
It killed them.
One of the HIV vaccines that we tested several years ago actually made individuals more likely to get infected.
It killed them.
So you can't just go out there and give it unless you feel that in the field, when someone is getting infected and exposed, being vaccinated doesn't make them worse. That's why you got to do a trial.
Yeah, that's important to get out there. So
did that look sincere at all, folks? You saw him talk about the testing and everything else that he has a financial interest in. He looked very sincere when he said that. Did that look sincere?
With that, yeah.
Vaccinated doesn't make them worse. That's why you got to do a trial.
Yeah, that's important to get out there. So with that context of these extended trial periods, even when you're doing heroic work to get these a vaccine candidate tested quickly.
Heroic work. All right, let's just stop that right there, folks. It's hard for me to go through this. Now, again, heroic work. We know that these people are using influencers, okay? We looked at it. We looked at the information. They're using influencers and celebrities. Oh, where'd it go? I apologize. Hang with me. Yeah, real cool. Medical dress up. There we go. Engages influencers and celebrities to help increase awareness, amplify accurate messaging, blah, 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 to manipulate you. More manipulation based off of the data they collected back here. They know exactly how you're going to respond, folks. This is predetermined. This is not an ongoing crisis. This is predetermined. And I want to show you something, okay? This is where it starts. This is how deep this rabbit hole goes. On the CDC site, and we already made a video about this too. We actually used the cover here, or some of the images on the inside for the cover of one of our videos. But I'm just going to click through. Now remember what Mr. Zuckerberg just said about his heroic attempts to stop the virus with the Chan-Zuckerberg Foundation, okay? I want you to see this is part of STEM school stuff going on right here. This is a STEM program. So this is going to 4-H, which is one of the largest groups of young people in middle America, hometown America. The USDA, I mean, obviously they have huge involvement, but here they are. Here's everybody that was involved. Now, I'm going to scroll through this kind of quick. Here you go, folks. This is no joke. Okay, you can view this for yourself right here. You have Operation Outbreak. 10:05. It's 10:05 on the clock. Just notice that, okay? Well, it's actually 10:04, but anyway, 10:04 on the clock. 10:04 over here. You're going to start seeing a whole lot of scary, freaky stuff right down to the Zuckerberg look-alike that they use in the cartoon. So, they got the kids using tech here, playing this cool game. And it's the Disease Detective Camp, okay, right here. Some of you guys complain that you can't see this stuff. Let me make it a little bit bigger for you. Here you go. Oh, too big. There we go. So the disease detectives. Okay, again, that's that same kind of stuff you got going on back here with these guys. Let's see. Let's hit the About Us. Got some core initiatives down here. Education, justice, opportunity, science. Sounds good. Grants, ventures, technology, advocacy, movement capacity. Sounds good. Just went bad. Just went all bad. All bad. So, let's just keep moving along here. We're going to keep plugging along. Let's flip back to your junior detectives and how this guy, well, I'm sorry, what was it?
Even when you're, so with that context of these extended trial periods, even when you're doing heroic work to get these a vaccine candidate tested quickly, one of the strategies.
Even when you're doing heroic work. So here you have who I'm just going to go ahead and call the creepy semi-Zuckerberg lookalike cartoon character, who's picturing a scary outbreak of a new scary disease that has already infected half of the city's population. If you go back to this in the very beginning, this guy blatantly says that his estimates I was trying to see if I could find it quick. Watch the whole video. He says that according to his estimates, 50% of the population is going to get this disease. Now, it's interesting that he has his own estimates and that Fauci has his own estimates and that suddenly, not too long later, this guy's estimates became this guy's estimates. Perfect. So, let's look at this. Okay, what do they talk about in here? He turns into the only hope to deliver it on time. He remains cloaked to move quickly and unnoticed. He doesn't want to be stopped or slowed down. Hospitals and clinics are currently overwhelmed. Some cases, people are being turned away. Sound familiar? The CDC on the TV with breaking news on every channel. Sound familiar? City streets are largely deserted with the exception of locations near medical facilities, aka essential facilities. Sound familiar? Will he make it in time? I don't know, folks. But see, here he is, just in time to deliver the cure from the CDC. Come on, you guys. This is getting pumped into your kids. And hey, just in case he doesn't match your racial preference, let's spin it again. This guy is going to turn into a medieval archer, and you guys are all there with him. Hey guys, it's Eddie. Wow, I'm in a suit of armor. Sound familiar? Medical dress up, folks. Your suit of armor, right here. You know what this actually means? You guys haven't been watching a whole lot of Handmaid's Tale, I guess. This means that you're silent. This means that you're submissive. That's what that mask means. Make no mistake. So let's go back here. This guy's in his suit of armor. He's got his gloves. He's got his PPE. He's got his PPE suit of armor on. Isn't this supposed to be public health related, RJ? So he's questioning it. They're questioning. Hey, this seems a little far-fetched. But, you know, this is nerdy, but I like my outfit. Hang on, guys. I promise this is public health related. Let's just skip forward a little bit. So when you get an infection, your body learns everything it can about the germ that causes the disease. Your body cells will remember what that specific germ looks like. A lot of us call that community immunity. But they don't want to wait for that. They want to leap into action and help you handle it all on your own. Let's scroll down to the next version. You've got the girls version. Let's see here. What does she got? Uh-oh, we're going spacey. We're going spacey. So the space station is full of people infected with an alien virus, but she is completely unaware. If you're in a contaminated environment and don't take proper precautions, you could get sick too. You're seeing this, right? I'm just going about my business. Little do I know the space station is contaminated with the virus. Just by being in the environment, I'm exposed to the environment. Home isolation orders, folks. The virus can enter a person's eyes, nose, or mouth to cause an infection. Oh no, it's gotten to me. Don't worry, I'll be safe. I've been vaccinated. Vaccines work by causing your immune system to recognize and fight against the attacking virus. Oh wow, Chris, that was scary. This one turns it into a sleuth. Now, once this little class shindig of theirs is over, I want you to see what craziness actually happens. Let's keep going. Later on, they go to the county fair. Oh, by the way, if you guys don't know, a majority of zoonotic viruses are developed right around the same time as every county fair on the frickin' planet, especially in the United States. Think about the time frame, folks. When are your county fairs going off? When are your state fairs popping off? When are a large amount of animals going to be right next to each other causing, zoonotic viral mutations? I don't know. County fairs. That'd be a great place to release a virus if you were going to do that. Not saying that's what happened, just saying that'd be a great place because you'd sure have a lot of cover from these cool pigs right here where the coronavirus, COVID-19, allegedly came from. Remember, it's not a bat. There was no bats at that market. It must have come from something else. So let's take a look here. Eddie and his friends, they go to the fair. He enters his pig in the contest. They go grab some food. They're all going to go home. This guy's doubling up on corn dogs. I can't blame you. I do the same thing. I've got that in my other hand and 2 corn dogs in one hand. I'm not the epitome of health, guys. So now they go into the horror house where the gas is seeping out of. There's the fog in here. Nothing to worry about. Uh-oh. Somebody's starting to get sick. His asthma might be kicking in. Asthma. Just scroll back, folks. Look in your news feeds. You had a lot of people that thought they were having asthma or allergy problems at the beginning of this. So here's his inhaler, which, by the way, steroid inhalers and some other stuff have been shown to be beneficial. There's a lot more research being done. Google that. Do your own research. It's not medical advice. I don't give medical advice. I'm a data analyst, not a medical professional. So let's keep looking at this little piece of data that they gave us here. Some people like to believe that everything is not data. If you have a printed publication from the CDC, I'm going to go ahead and chalk that up to data. So now Monday morning, 3 days later, cough, cough, sneeze, sneeze. Uh-oh, he's got a fever. But Mom, I'll never get another chance to go to the CDC. Remember, he's one of the disease detectives. Meanwhile, his friends go to the CDC. They get their name badges. We got Dr. Alex here. We got Dr. Lee here. Welcome to the CDC, Dr. Allison. Yay. Wait a second. What? EIS officers. Oh, that sounds familiar. You mean intelligence service officers? Epidemic intelligence service officers? Ah, yeah, that's what you guys are. Sweet. So they start doing their little CDC thing. Meanwhile, back at Eddie's house, Eddie is not feeling better. She's going to take Eddie to a doctor. He's feeling worse. Now later, Monday at the doctor's office, he got sick Friday. Okay, now it's Monday. There's your 3-day incubation period. He had a 101 fever, cough, muscle aches. Sounding familiar? These are the new CDC symptoms that were recently added, by the way, folks. Muscle ache, anyway. So just breathe normally for me. It appears you have an upper respiratory infection, even though we are no longer in cold and flu season. Here's your little nasal swab happening. Don't know for sure. Going to take a sample. Call if he feels worse. Okay, he's at a high. People with asthma are high risk for developing complications from respiratory disease. Very true. So now you got Tuesday at the lab. They call in and say they're unable to identify the virus. Uh-oh, you got a novel virus. Look at that. Meanwhile, back at the CDC, they're still doing their little tour of the CDC discussing no other than malaria and vector-borne diseases, zoonotic diseases, influenza. Oh, you guys didn't know that? Influenza, aka the flu. So again, that's when most of those zoonotic pathogen mutations happen, right around county fair time and state fair time. And they tell you exactly how it happens right in here. So foodborne diseases are zoonotic. So again, they're leading right back, zoonotic, foodborne. You see where we're going with this? Wuhan bat market? Let me keep going. Back at Eddie's house. What's wrong, Eddie? I can't breathe. Mom, I feel worse. I can't breathe. Wednesday, early morning. Remember the onset, folks. 2 days later now. Eddie, how are you feeling? Eddie! Now Eddie is non-responsive and barely breathing. We may need to intubate him. Pulse is rapid and thready. Let's get him into room number 2. I'll start a line. Is any of this sounding familiar yet, folks? You should be deeply disturbed by what we're talking about right now. Let's keep going. Later that afternoon, they got to take off. These disease detectives got to take off. They got to go fix the problem. And you got the kids leaving the CDC disease detective camp. They're going to figure it out. Everybody's going to work together. Later at the emergency room where Eddie's being treated, the kids show up. They start figuring out what they're going to use what they used at the CDC disease detective camp and try and figure out how Eddie got sick. So now you got kids that thinking they know stuff because they're part of a CDC disease detective program. They got a cool piece of tech, a little app in their hand, and they know stuff. And because they do that stuff, you know what, Mom and Dad? They might even know more than you. But let's scroll back. Let's keep going. Let's keep going on this. So here you go. You got the team arriving to the local health department. You got the kids working the case. You got the local health department. She's flipping back into disease detective mode. They're looking at the respiratory symptoms like cough, difficulty breathing. Sounds like a respiratory virus, which isn't something that he would have gotten from food. Oh, but if it was a zoonotic respiratory virus, he would have got it from food, right? Right. So let's scroll back. Now the doctor shows up at the emergency room. Oh, hi, what a coincidence. Definitely a coincidence, folks. Now they keep going. I'll follow up with our state public health colleagues to get a hold of a fair organizer. So now they're going to start looking at the fair. Yes, Eddie had a pig at the fair. Now they're talking to the fair organizers. Some of them had, 3 horses had colic, some ringworm. A couple of the pigs had a mild fever. It took samples. So anybody, any reported illness? Here comes the contact tracing. Back at the CDC lab. It's a new flu virus with genes from pigs, birds, and human flu viruses. That's interesting. Here comes the death clock. Here comes the John Hopkins death map. The countdown, or in their case, the count up. Let's just keep going. So, it hasn't spread from person to person yet. Back at the hospital, Eddie's on life support. Keep fighting, Eddie. Keep fighting. Uh-oh. His subconscious Eddie races to find a way to activate his immune system against attacking viruses. He's racing. He's racing. Access granted. This will target my immune system against the virus. It's the magic vaccine. Not a moment too soon, folks. And he miraculously pops out just in time, feeling perfectly better a week later. Huh. Isn't that what happens to most people that get this new virus? You get a little sick and then you're fine. I mean, obviously they didn't quite go through what Eddie went through there, but you get a little sick and then they're good. That's a majority of the people, right? Finish this off on your own, folks. But I'm going to stop right here. I want to show you something extremely important that's tucked in here while they talk about all their cool vaccines for the flu. Flu viruses from pigs infect people. It's called a variant flu virus infection. She said variant infections don't happen often, but some occur every year, particularly during fair season. Variant viruses are different from the flu viruses that normally make people sick during the flu season. Since people aren't often exposed to viruses from pigs, most don't have antibodies. So if you were exposed to normal flu, you would have antibodies. But since you're not exposed to flu from pigs, you don't have antibodies. So as they learned in their disease detective camp, the safest way to get antibodies is through vaccination. And although the flu vaccine isn't designed to protect against variant flu, it's still important to get because it can help protect us from getting the flu and spreading it to others. What kind of twisted doublespeak is this? Hello. This is what they're pumping into your kids, okay? Let me just steer away from this. Remember the last thing that this guy was talking about?
Of all the many approved by leaders, many of them unelected, are allowed on information platforms. Does that sound familiar? It sounds a lot like China. Of all the many ironies of this moment, so many of them bitter, the hardest to swallow is this one. As we fight this virus, we are becoming far more like the country that spawned it. We are becoming more like China. It's horrifying. And it tells you everything that our professional class enthusiastically welcomes this. Over the weekend, The Atlantic magazine published an article by two academics calling for an end to freedom of speech in America. Their model for an ideal system, the totalitarian government of China. Quote, in the debate over freedom versus control of the internet, China was largely correct and the U.S. was wrong, end quote. You ought to read the whole thing. Truly, you should. It's the future. We could quote from it from the rest of the show, but we'll give you just one more. Quote, significant monitoring and speech control are inevitable components of a mature and flourishing internet, and governments must play a large role in these practices to ensure that the internet is compatible with society's norms and values.
All right, let's stop there because I told you we were going to circle back all the way, so here it comes. Here's your perspective article again from the people at Vital Strategies who are, regardless of this name, this perspective is coming from Bloomberg, from the Chan-Zuckerberg Initiative, and from the Gates Foundation, who we're getting to next, folks. We're not even done. We're close. Again, remember, I told you they want to start using NPIs to avoid SSEs. And SSE is something that's going to spread the virus around, okay? Superseding event. What is an NPI, though? Now, remember, that dude on the TV just said that we're acting more like China. So what do these people, how do these people want to respond to a virus in the future? In Wuhan, aggressive implementation of non-pharmaceutical interventions, NPIs, in the community, including a cordon sanitaire of the city, suspension of public transport, school, and most work and cancellation of all public events. That's what they want to do. And do they think you're just going to settle for that? Absolutely not. They know that you're not going to settle for that, as a matter of fact. It's not a question of whether they think you're going to settle for it. They know exactly how you are going to emotionally respond to the release of the data. And they talk about it right here. Let me show you. Because of the societal and cultural underpinnings of behavioral environmental factors, including the local acceptability of adoption of NPIs, early engagement of communities, including an in-depth understanding of knowledge, attitudes, and practices relevant to the pandemic will be critical to response efforts during all phases. So their early engagement, I just showed you that early engagement. And it's freaky. It's scary. It's right here. It's called Operation Outbreak. And the 4-H has been pumping it into your kids for years. The USDA is pumping it into your kids for years. Here you go. Operation Outbreak. I hate having to circle back to this stuff. But they know without a shadow of a doubt how you're going to respond to this because they did this study on you and they manipulated your feed. They manipulated your data. The same thing we're saying that the CDC has been doing. Let's keep going. Let's just keep plugging forward. And since we're talking about China, here's some of the first people in China to discuss what was happening over there. Guy says, I felt like the common cold. He has since recovered and is sent to come home in the next 2 days. None of his other family members have become sick. The authorities have acted swiftly to clamp down on discussion about the outbreak. Discussion about the outbreak. Clamp down on discussion about the outbreak. Censors block the hashtag Wuhan SARS, just like they're blocking Debunk This Fauci, but we beat them to it. If they block us, they block their own stuff. The police say they're investigating 8 people in Wuhan for spreading rumors online about the disease. An announcement that was met with anger, one of China's most popular media sites. Okay? I don't have the right to speak, and I don't even know the truth, one user wrote. Don't I have the right to panic and save myself? That's what they want you to do. That is exactly what they want you to do. They want you to panic so that you have to rely on their information. Now, let's keep going. We showed you this briefly earlier. Masks are not effective at preventing the general public from catching the coronavirus. That's from the Surgeon General right there. But what other information is available that would suggest these home isolation orders are not a good idea? Okay, let's look at other relevant data that's being stifled right now, that's being ignored. I wouldn't do my part as a human being on this planet if I just went through all that other information, tearing it apart without giving you something useful. So, a total dose of approximately 700,000 plaque-forming units. Okay, that's what they're using for their exposure rate. Virus was shed from the nose and throat. Okay, they did not exhibit clinical symptoms. Virus shed from nose and throat. Let's just keep going. Let's scroll through this. This is important stuff. Transmissibility. I'm going to make it bigger so everybody can see it. How does it spread from one host to another? It's easily passed between humans, likely through close contact and with relatively large droplets, and possibly through smaller aerosolized particles. This is important. Again, these people are only promoting part of the data. Okay, they're using social influencers to control the data. They're using Facebook to censor the data. They're trying to prime or prep the CDC so that because they know how you're going to react based on their previous experiment. Okay, so what you have, let's roll back over this real quick. The implementation, I can't even talk. It's so frustrating. I apologize. The implications of the document I'm showing you. Okay, let me recap from the top down. You have this document which is trying to give the CDC and other medical professionals perspective. Okay, so that's called priming in the industry. In marketing, in advertising, that's what we call priming. So then you have vital strategies. Who's responsible for the priming? Zuckerberg, Bloomberg, Bill and Melinda Gates Foundation. They're working with the World Health Organization. They're working with Bloomberg School of Public Health at Johns Hopkins. They're working with the CDC, the World Bank. They're pumping stuff into your kids through the campaign for tobacco-free kids. Okay? It's all happening. Don't think it's not. So, let's just keep going. What you have is Vital Strategies and the Resolve Initiative, funding from Bloomberg, funding from Zuck, funding from Gates. You have the New York Trace program going into effect right here using this technology, sponsored by these people, whose goal is to vaccinate everybody. We already went over that. They're censoring information that is contrary to their goal of vaccinating everybody. They're using their platforms to control and manipulate your emotions and your knowledge. They're using celebrities and influencers to do it with a game of medical dress up, a visual cue similar to someone, I don't know, perhaps clicking a like button or a dislike button or an angry smiley face. Hey, did you guys know they put a new emoji out just for COVID-19? You guys might want to check that out. Again, if you think they're not doing that so that they can track you and your emotional state with this, that is what we call in marketing and advertising is a direct indicator, meaning if you were to hit that little emoji, you're their target audience. You have identified yourself as their specific target audience. They're going to continue to manipulate your Facebook feed, your Twitter feed, your Instagram, Google search results. All of that is currently being manipulated. We've already demonstrated that. But what isn't being manipulated is this data. It's just being stifled. So let's get it out there. SARS-CoV-2 is believed to spread through close contact and droplet transmission. Keyword in that sentence, believed. With fomite transmission likely. Keyword, likely. And close contact aerosol transmission plausible. Keyword, plausible. Why are all those the keywords? Because they're all unconfirmed. Aerosolized virus has been detected in COVID-19 patient rooms with particle sizes in a range that we could inhale. And those have been found in extensive contaminated patient rooms. So there is a potential for airborne transmission, though to date, infectious virus has never been isolated from aerosol samples. To date, never been isolated from aerosol samples. But yet here you have medical dress up, masking for a friend. Why? Because they're trying to stop an airborne transmission. Folks, if this was an airborne transmission, you'd have your eyes covered. For my Spanish-speaking friends out there, your ojos would be covered. Okay? Now, let's get to some more information. We already showed you that home isolation of persons with suspected COVID-19 might not be a good control strategy. Where does this info come from? The CDC. The other information we just showed you about it not being airborne. Where does this info come from? The Science and Technology Lab at the Department of Homeland Security. It's a level 4 biolab. So if you guys have any questions about the data I'm giving you, I can't answer them past what I've already told you. I suggest contacting these people. They'd be happy to answer your questions. It'd be nice if they answered the questions of some of these politicians that you see on the Chan-Zuckerberg Initiative pages doing interviews with Chan-Zuckerberg. Why are these people doing these interviews? I mean, look at who you've got wrapped up here, folks. They got a little thing here. Oh, paused it. You don't get to play for me. I mean, here you go. Here's Frieden himself, right there. Okay, who else we got here? Hey, isn't that Gavin? Isn't that Newsom, California? Interesting. Hey, look at infectious disease detectives. What, you guys thought I was kidding? No, this is happening. This craziness is actually happening. So while information like this from extremely reputable sources like the Department of Homeland Security's Level 4 Bioweapons Lab, Science and Technology Division, and the CDC themselves, while information like this is readily available and proves that these home isolation and that these business closures are counterproductive. Another thing that this study talks about is how fast sunlight kills this virus. I can't scroll through all the way right now to show you, but I promise you, if you look this information up, it tells you exactly how fast the virus dies. Okay, it's fast. You put this virus in sunlight, it dies in minutes, folks. Its half-life is minutes in sunlight. Now, all of this talk is leading us. You've got vital strategies, the resolve, the funding, the New York Trace program, Zuck, Gates, the counterintelligence program being pushed by Google, by Facebook, by Instagram, by Twitter, by YouTube. Everybody being directed back to the WHO, who just got their main funding source, the United States cut, who now has a new funding source, a new main funding source, which is Bill Gates, the Gates Foundation. You've got Zuck controlling the dissent. You've got the Gates Foundation controlling the World Health Organization. So while Facebook, Instagram, and other media sources are providing perspective and disease detective programs and social media influencers and celebrities and doing behavior change campaigns. I mean, it's a behavior change campaign, friends. I don't know what else to call it. It's a behavior change campaign. That's what they call it. They're trying to change people's behavior. So please take a look at the stuff they have going on here, okay? Last but not least, I'm going to leave you with this.
Zero. This equation has four factors, a little bit of multiplication. So you've got a thing on the left, CO2, that you want to get to zero. And that's going to be based on the number of people, the services each person's using on average, the energy on average for each service, and the CO2 being put out per unit of energy. So let's look at each one of these and see how we can get this down to zero. Probably one of these numbers is going to have to get pretty near to zero. That's back from high school algebra. But let's take a look. First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%. Now, if we do reproductive health services, we could lower that by perhaps 10 or 15%. Now, if we do a really great job on new vaccines, healthcare, reproductive health services. Growth issue at the global level is not that daunting. That is, the population percentage-wise is growing slower today than in the past, and so it will actually peak out. The problem is that the population is growing the fastest where people are less able to deal with it. So it's in the very poorest places that you're going to have a tripling in population by 2050. And so their ability to feed, educate, provide jobs, stability, protect the environment in those locations mean to do is take this aid generosity and this innovation and go into those places, offer the women better tools where they want to space birthing or have a smaller family size, and improve health, because it's amazingly, as children survive, parents feel like they'll have enough kids to support them in their old age, and so they choose to have less children. Niger right now, it's still 7 children per family, whereas in the richer countries, you're often at a stable point of which is 2.1 or even less. And so it's really an acute problem in a certain number of places, and we've got to make sure that we help out with the tools now so that they don't have an impossible situation later.
And again, I didn't make that video, so I just wanted to shout out to Kenya News Media. I don't really know what else we need to throw in here, guys. I've blatantly connected every single dot, and like I said at the beginning of this video, if you think this is a conspiracy theory, feel free to jump into the comment section, take the exact minute from the video that you believe you can debunk, and by all means, supply the data that debunks it. Because again, in the true interest of science, I'm a data analyst. My only interest is data. I have no political interest. I have no religious interest. I have no interest in your feelings about the topic, other than the fact that they're clearly being manipulated by the same people that are censoring the information that they don't want you to see because they have a financial interest in gaining more fear from the news media. If it bleeds, it leads. And right now, these guys are making a ton of money. So real quick before we go, I just wanted to say you guys need to keep your eye out for this kind of stuff, because this is perspective, which means there's going to be other stuff coming after this. I showed you exactly what they plan on doing to you. I showed you exactly how they plan on implementing it. I showed you who's paying for it. I showed you where it's being implemented right now as you sit here listening to this. And they think you're stupid, people. I'm not saying that to make you angry. I'm saying that because it's true. They think that we are so dumbed down at this point that no other individual would be able to just simply sit down at the web, start opening up search engines, and find all of the exact pieces that I just showed you. From the tinfoil hat quackery ratings on blatantly true information, to vaccines, disease detectives, NIAID and Facebook working together, CDC and Facebook working together, governors working together with these NGOs, the disease detective program, priming your kids through 4-H so that right now your kids are going to be the ones, and this is what I want you to explain, your kids are going to be the ones to dissent, and they're dissenting to go with what is the popular opinion. They're dissenting from you. They're dissenting from their parents. They're dissenting from reliable information sources in exchange for that little device strapped to their hand. And that little device is being extremely censored right now. Horribly censored. Everybody knows that. I showed you. Even the information here is being censored. You got the Surgeon General talking about how masks are not going to protect the general public from catching the coronavirus. You've got the Department of Homeland Security talking about it's not airborne. You've got the CDC themselves saying in journal entries saying that home isolation might not be a good control strategy and is leading to increased familial cluster infections. And it all wraps around the same thing. It wraps around Bill Gates and Zuckerberg wanting to force, they want to tag, trace, isolate, and mandate vaccines on the entire planet. I don't know how else to explain this. I don't know how else to connect the dots that I could do it to make it any more clear. But that is exactly what this is about, folks. They are manipulating data to cause a never-ending curve. This curve will never go away, and no better example of that is sadly my own home state, where even though we had no new deaths one day, we have a few the next day. Our Department of Health Services and says unless the CDC guidelines say that there has to be a 14-day downward trend. Okay, well, if you keep people isolated, you're going to keep causing cluster infections. You're going to keep having comorbidities. You're going to keep having more data manipulation. You're going to have a longer curve. And this guy gets to do more testing, which makes his company more money. And maybe they get to sell you some vaccines down the road. It's not a tinfoil hat quackery. Here he is right here. This is what TGen wants to do right here. This is not a conspiracy theory. This is a fact. I am begging everybody that sees this video to share this video everywhere. It doesn't matter where you're sharing that at this point. This is the Paul Revere ride through the information age, folks. I'm going to wrap it up with a quote that was said on one of our videos earlier at the hashtag DebunkThisFauci website. And this quote struck me as extremely powerful. So coming from JCJ, posted 15 hours ago. And I don't know if he's quoting someone else, and I don't know if these are his words, but damn, JCJ, well said. And I quote, "We are witnessing the launch of a green techno-fascist order where universal basic income, digital ID, and mass surveillance limits the consumption of scarce resources, and production and distribution is automated. We are being manipulated into total dependency. Vaccines destroy our ability to develop natural immunity, creating dependency on corporate bioscience, just as GMO seeding destroys natural seed production, creating dependency on corporate agroscience. Life is a creation, not a means of exploitation for technocratic dependency." Let that sink in, folks. Shout out to JCJ, the guy that put that up on our page. I appreciate every single one of you. Share this video. Make mirrors. We're going to be having our own website up. It's going to launch this Sunday. We'll have this video up there because we know they're going to try and shut this down. Share it while you can. One love, everybody. Stay safe. Stay healthy. Keep sharing the real data, please.